Thank you so much for joining us here today. My name is Janine Humber, the Events and Program Analyst with AARP Massachusetts. As you may already know, we're fierce advocates for what matters most to older adults, from ensuring access to affordable housing and healthcare to protecting vital programs like Medicare and Social Security. We know how important it is to lift up the voices of older adults in shaping the communities we all live in. But advocacy isn't only about policy, it's also about practical, joyful action. That's why we offer engaging programs like this one, where we can come together, learn, and be part of something bigger. I would like to introduce to you Ellen Diapola, and she will be presenting your presentation today. Thank you so much. Ellen?
Thank you. I'm glad to be with all of you today. I am Ellen DiPaolo. I am the president of Honoring Choices Massachusetts, and I'm going to tell you a little bit about the organization. And the focus today is how to make sure you have everything you need, free documents, tools, and information to make your own personal healthcare plan. And in that personal plan, be able to think about what it is you want for care right now, today, and then to write it down in some planning documents, just in case you can't speak for yourself at any period of time. And that way, those documents can speak for you and be a real help to your family and friends. And they do a lot to really help our care providers and our doctors know what it is that you want for care. So we'll go through that today. And if you have questions, as many people always do, even though sometimes these documents can be kind of simple, getting them to work for you can be kind of complicated in our healthcare system. So yeah, just go right ahead and put those questions in chat, and I'll stop periodically to answer them as we go. Okay, let me put up the slide deck, and I'll just check if everyone can see that. Here we go. Now, is that something we can see? Janine, is that something you can see?
Yes, Ellen, it is sharing perfectly fine. Thank you so much.
Thank you. We just never know with technology these days.
Oh, I understand.
All right, so again, I'm from Honoring Choices, Massachusetts here, and we really, this is about making your own healthcare plan. We're delighted to be with you today. We do these consumer webinars many times a week, and we get a lot of great information from all of you about what you need, what's working, and what's not working. So please feel free to share that as we go today. Honoring Choices is a nonprofit. We think of ourselves as a consumer nonprofit to work under Massachusetts law and saying, this is your healthcare and this is your choice. And our job is to inform and empower just everyone who's 18 above, quite frankly, anyone who's an adult, to take control of those healthcare choices and make a plan. At the same time we're doing all that, we're also supporting all of the healthcare providers in the state, our doctors, nurses, people in the primary care offices, the hospitals, and way beyond. And we're giving them the exact same tools that we give you to say, have a conversation with folks and help them make a plan. And what our partners tend to do then is to work with you on having those conversations and getting you the kind of care that you want right in your community. So this is how we talk about this, very simply, that everyone is on a healthcare journey. We all want the same thing, to be able to get the best possible care, whether we're just promoting everyday wellness, no matter how old we are, or we're managing our health needs as they're changing and chronic illness, or we're at a point where we're living with a serious or advancing illness. We all just want to get care when we need it. And we just think everyone needs a plan, that healthcare plan, a way to write down your choices and think about them and share them with your doctors, becomes that personal roadmap for you to make sure you can get that quality care. And making a personal plan really helps everyone. We've been at Honoring Choices now for 13 years, and we have heard over and over again, this is just part of life, right? We get ill, we have accidents, it's just part of everyday life. But if you have that plan, it really protects you in terms of saying, this is who I am and the care that's right for me. We have heard over and over again how it can support friends and family in knowing what a person wants for care, especially if you can't speak for yourself, even for a short time while you get better. And our care providers have told us over and over again how important it is for them to have these planning documents so they have some instructions, they have some directions on how to help you. So that's what we're going to do today. And I wanted to start with some basic information because this healthcare system we try to navigate every day can be kind of confusing. And there's a lot of policies and procedures that you get that may not make sense. But no matter what, at the basic foundation of this, you have rights. Adults have, we're going to look at 5 rights today. You have many rights. You have many fundamental and civic rights, but these are the ones we tend to talk about at Honoring Choices around healthcare planning. The first one is just to be able to get information to make informed choices. It's actually written in the law that you can work with your doctors and keep asking questions until you feel like you've got enough information in the way you can understand it so that you can make a choice about your care. But sometimes that's called informed consent, especially in hospitals, we hear that term. But it just means that you have the power to get the information you need. You have a very strong right in number 2 to say, yes, I want this care, or no, I do not want this care. You can accept and refuse those medical treatments. Very clear in the law is that everyone who's 18 and above gets to choose a healthcare agent in a healthcare proxy. That person, and we'll talk a lot about the agent today, but an agent is a person who you trust, someone you pick to say, if I'm not able to talk to my doctors or communicate, even for a short time while I get better, if I'm not able to do that, well, here's my agent. Here's the person I choose to do that for me, to make those decisions. And in this state, it's very important not to just choose that person, but to write their name down in a healthcare proxy. We'll talk a lot about that today. The fourth right, just generally, is that you can write down your care choices in those planning documents. We look at 5 documents. We'll show you what they are today. But that is part of your right to make this plan and to say, this is what I want you to know about me and how to take care of me. And then, of course, the 5th right is to be able to receive care as best as they can get it to you that honors your healthcare choices and your goals right throughout your lifetime. So we're not just talking about making an advanced care plan, and that's a pretty, that's a term that's used a lot, but a good plan for today, right now, today, and all through your lifetime. So generally speaking, we just try to keep those at the base because, as I say, sometimes, when I was at my primary care doctor's office the other day, I just was asking questions, and she said to me, well, you're asking a lot of questions. And I was able to say, you know what? That's my right to do that so that I can know how to make a choice. And she was very nice about listening to that. So what we have in Honoring Choices is a program. We took a lot of information, put it together in a program called Who's Your Agent? And we offer some toolkits. And the Who's Your Agent program is just that. It's saying you have a right to make decisions. A good place to start to make those decisions is to choose a healthcare agent. And that's why we call it the Who's Your Agent program. It's got 2 toolkits. Most people start with the Getting Started toolkit. It's been very popular across the state. And all it does is say, let's just start simple. Let's just start with a simple conversation to complete a healthcare proxy, if we can, and a personal directive. That's another document we'll tell you about today. That personal directive, or sometimes called a living will, it's the way we give instructions to our agent and to our doctors about the kind of care we want. So we're going to focus on the Getting Started toolkit today, and then we'll show you where the Next Steps toolkit is. And that's that second part. So after you start to do these documents, you have conversations. Some of you may already be there. you've done this first part, there's a second part, which is to keep building on those conversations with your doctors. And then think about adding other planning documents to help manage your chronic illness or to live well with serious illness. So we'll show you where all that is today. These are the 5 documents that we talk about when we talk about care planning. They're in those 2 toolkits. In the Getting Started toolkit, we're really focused on the healthcare proxy, which is a legal document to appoint someone to be your decision maker if you can't make decisions, healthcare decisions for yourself. And then the other document is a living will. And what we did at Honoring Choices is we made our own living will called a personal directive, just so it's free and it's available for everyone. And it's personal, which means that your doctors are not legally bound to follow it, but they so appreciate the information because it really tells people what's important to you and your instructions for care. And I'll show you both of those. The next step toolkit, we tend to focus on adding other documents, including a durable power of attorney, which is a legal document. We'll show you what that is. But basically, you're appointing a financial decision maker there. Then we have 2 medical orders in the state. I'm sure most people have heard about a do not resuscitate order, or a DNR. Its official name is Comfort Care Do Not Resuscitate. And it's an order that comes from your doctor, where you sit down with your doctor. Usually people are at a stage in life where they have a serious or advancing illness. And the question is really simple. It's like, if your heartbeat and breathing get compromised or stop, and then stop, do you want us to resuscitate you or to attempt to try to restore your heartbeat and breathing? And if that's a decision you want to make with your clinician, you can talk about it with them, and they can fill out this do not resuscitate order. And that gives instructions to all of your providers, not just to keep you comfortable. That's what the comfort care part is about that, but not to resuscitate you. So most people have heard of that. The MOLS form, it came into the state about 14 years ago or 15 years ago, and it's known as medical orders for life-sustaining treatment. And again, that's another order only for people who have a serious or advancing illness. It's not for everybody. It's when you hit that part of life where you have an underlying illness that's life-threatening. And you want to talk with your clinicians about what happens, what kind of end-of-life care treatments do I have? They're really called life-sustaining treatments. We'll show you that form, and we'll tell you when and if you want to use it. I want to first say that every one of these documents is voluntary. No one should say to you, you have to fill it out in order to get care. We're hearing that. And that's not the law. It certainly is very helpful to have some of these documents as you go, but it really is always your choice. If there are any questions about this, we're going to talk more about, especially all of these documents, but please just put them in the chat. They're not always easy to understand, and what we find is there's a lot of misinformation out there about them. Okay, so again, what we wanted to do today is just to make sure everybody knew how to start a simple conversation and use our Getting Started toolkit. And what we like to say, and it's kind of proven true in the last 13 years, it's as easy as 1, 2, 3. It's made for you. I think you all have a copy of this, or else very easy for us to get it to you. But that first step is always about, if you can choose a person you trust to be your healthcare agent, that's such an important thing to do, and to write that person's name down in a healthcare proxy. We'll show you more about that. Step 2 is that now that you've done that, what do you want to tell your agent about what you want for care? And you can write that down in a personal directive. And the other beauty of the personal directive is that there's a good amount of people, we think about 30% of the people in the state, who actually just can't choose a healthcare agent. There's just no one to choose, or they have other reasons they're not able to do a proxy. They can start with a personal directive, and we'll show you how to do that. Because the most important thing in this process is that your care providers, your family, know what you want for care. And you can write that down in that document. Step 3 in the toolkit is just making sure you're getting those documents to your care providers, your your primary care physician, and they're getting it in your medical record. And that also gives you an opportunity to have a great conversation with them about, hey, here's my agent. If I get sick tomorrow, here's what I'd like you to do. Yeah, I'd like you to talk to my healthcare agent and get me some good care. So one of the things these documents do is they help you start really good conversations with your care providers. So we're going to focus on this Getting Started Toolkit. And it's as we said, everything here is really based on Massachusetts law, and that's important because that really equalizes the process here. And under the law, that first step is choosing an agent if you can, and filling out a proxy. And we have a video for you on that right on our website, on the resources page. A lot of tools are right there for you. But under the law, the person you choose is actually called a healthcare agent. And that's why we use that language. It says it right in the law. And it's so much easier to talk about an agent as a person. And then what you do is once you choose that person, you talk to that person about what you want for care, you write their name down in this legal document that's called a healthcare proxy. You'll see those two terms, kind of talked about differently, but we wanted you to know that's what the law says. And another important piece of Massachusetts law, which is different than all of the other states around us, is that your spouse, your family member, your caregiver, they don't automatically have legal authority to make decisions unless you put their name in the healthcare proxy. So, for instance, we can hear from we talked to a gentleman the other day who said, "Oh, I don't have to do this because my wife will just tell the doctors what I want," and that's true. They'll always ask the spouse. But if someone else in the family disagrees with the spouse, and you haven't appointed that spouse as the decision maker, they don't automatically have the authority to make those decisions. So, as one person said to me, I have to appoint a quarterback, or I have to appoint a coach, and that person's name goes in the healthcare proxy, and then that person has the authority to make those decisions. Makes sense, I hope. So in the Getting Started Toolkit, pretty simple, it'll take you through these steps. Number one is to choose a healthcare agent, if you're able to do that. You want to just choose anyone you trust to be that agent for you. Now, as we said, we have learned over the last 13 years that not everybody can do that. And so if you're in that category, if you know someone who says, well, I'd like to do this, but I don't have someone to choose, what we say is, you know what, that's okay. You're just going to start with step 2 in this process and the personal directive. But just starting at step 1, if you're able to choose a trusted person, you want to talk to that person about being your agent and what you'd want for care in a medical emergency, and then appoint that person or write in that person's name in that healthcare proxy document. Now you can do these documents yourself, and we're going to show you how. But first, why do we do any of this? It's because we know we have a system that can be really chaotic, or, we go to the emergency room or if we need help, and it's so great to be able to have an advocate there. That person is able to step up. If you can't make decisions for yourself or hear what the doctors are saying about treatments and make a decision, that's what that person does. They can step right up to talk to the doctors, listen to the doctors, and make some decisions for care. And as we said, we repeat again, we have to put that person's name in a healthcare proxy to give them that legal authority. Who can be an agent? Anybody, really. It's anyone 18 and above, anyone you trust, a neighbor, a family member, someone at your faith organization or community group, your choice. It just can't be someone who works at a place where you're a patient. So it can't be your doctor or nurse unless that person is related to you. And what's an agent do? A healthcare agent do? Well, here's what we like to think about it, is that the agent makes the decisions that you want, not necessarily what your agent wants. That person is speaking on your behalf. So the agent's power, the healthcare agent's power, is to step right in if you get really sick and you can't really talk to your doctors, to talk to them, to talk about, what's wrong with you and what the treatment options are. And to be able to look at your medical records and tests, and then to be able to make those decisions based on what you would want. And let's say, we had a person talk to us about this the other day, about how they went into the emergency room in the hospital very sick. They had to have some procedure, and their agent helped them through that whole process. And then in the recovery room, the adult started to, feel better. And that the second that person was able to hear information and make decisions for themselves, then the power comes right back to you, and your agent steps back and has no more power. That's how that works. Here's the Honoring Choices Healthcare Proxy. This is free and downloadable on our website. Now, let me say you can use anybody's healthcare proxy. There isn't just one in the state. So you might want to go to your primary care doctor if they have one, or a hospital, whatever you like. But we put this up because we know it wasn't that easy for people to do. And we wanted to give the message that you could do it in many different languages. And you can do it yourself. You don't need an attorney. You don't need a notary. You don't need your doctor. Let me just bring you through this in a little bit so that you can see how easy it is. And even if you're using a different proxy, we made it one page because we just said, what does the law need us to do? And this is what it is. So in number 1, you'd put in your name and address, and that language underneath there is just that it's following the law and it's a valid document. Then number 2, you put in the name of your healthcare agent, their address, any phone number you want to reach them. This is your document. It belongs to you. You can write anything you want on here in order to get to that agent. And then the alternate agent you can pick, that's a backup, right? If the hospital, say, is calling and they can't get to your agent, they're going to call the alternate agent. And then it's the name, address, and phone number. You don't have to have an alternate, but if you can, terrific. Then you put that name down. The second part of that one-page document, number 4, it just talks about the healthcare agent's authority. And it's basically saying, here's the power the agent has, that I give my healthcare agent the same authority I have to make any and all healthcare decisions for me, including life-sustaining treatment decisions. Now, you can just leave it like that, but if you want to limit that agent's authority or give some instructions, you can write it in here. But if not, you just leave it blank. Now, the only trick to any healthcare proxy in Massachusetts is that before you sign it and date it, you have to have 2 witnesses standing with you in the room. The witness can't be the person you chose as your healthcare agent or alternative agent. You can't be a witness and an agent at the same time, right? So you have to choose 2 other people who are not your agent. And all they're doing is watching you sign this document. You sign first and date it, and then you give the pen to witness 1, and they sign and date it. You give the pen to witness 2, sign and date it, and you have a valid healthcare proxy. That's it. You can do this yourself. Number 7 is just optional in the state. Sometimes our doctors want to know if we've talked to our agents about accepting the job. So sometime after you do this and you sign it with the witnesses, you can go back to your healthcare agent and say, would you also put your name here? They don't have to, but the doctors like to see it sometimes. I see there's a question, and I'll just jump right on it. Can your agent live in a different state than you do? Absolutely. Yeah, this is a bit of a issue. You want to make sure then your agent has your documents so they can always prove they're the healthcare agent. And this would be, especially if they live in another state, it would really help for them to sign this form. Before COVID-19, it was a little harder when people were in different states, but now it's gotten a whole lot easier to be able to call them. And the issue the hospitals may have is, how do I know who we're talking to? So you want to make sure your healthcare agent in a different state, or even in this state, has a copy of the healthcare proxy. So they've been appointed. It's a great question. Thank you. So once you've done your healthcare proxy, even if you have one now, anyone at all, you can do this wallet card. It's in the Getting Started Toolkit and also on our website. And this has been a fun little wallet card to have because it's been really useful in getting to call your agent fast. So as long as you have a valid healthcare proxy document, you can do this card. This card is just pure information. It says, I have a healthcare proxy, and in an emergency, call my healthcare agent. So let me give you an example of this. First I'll just show you how it works. This is, you can download this long rectangle just on a regular piece of paper, right? You just come out of your printer that way. And then you just cut out the rectangle and fold it in three. And you can see in that middle section, that's where you'd write in the name of your agent, your healthcare agent, and their phone numbers. So we had a gentleman call us the other day to thank us for this card because he was shopping in a grocery store, and he just slipped and fell and hit his head and had a concussion, really was unaware. He was bleeding, so they called EMS, and EMS came to help him. And he wasn't really able to say who he was, so they look in his wallet, which is typical, and there was his ID and this healthcare proxy card. So they were able to learn who he was pretty quickly and who the name of his agent was. It happened to be his daughter. So they were able to call the daughter and say, hey, we're with your dad. He's okay. We're taking him to the hospital. Come and meet us there. So the daughter was so incredibly thankful. She wanted to let us know too how nice that wallet card had worked for him and just made him feel a lot safer. So feel free to use it. As long as you have a valid healthcare proxy, you can use this card. All right, so we know that there's a proxy. We know there's a wallet card. Well, what if you or someone you know is just not able to choose a healthcare agent? You just have no one to choose, or it's just not easy. So what we like to say is that's okay. There's no agent, no problem. It's great to have one, but if you can't, the most important thing is that you let others know how you want to be cared for in a medical emergency. And you can do that in a personal directive. So that's step 2 in the Getting Started Toolkit, when we're really focusing on you and what matters to me. So if you have a healthcare agent, this becomes something that they really can look at and read. These are your choices for care. It helps your healthcare agent. If you don't have an agent, that's okay. You want to write this down, and what people have done is shared it with their primary care physicians. So the doctor knows, the physicians know what you want for care. So in a personal directive, you just think about what's important to you. Most people have a sense of the care they would want and the care they wouldn't want. You talk to your agent if you have one, and if not, anyone you want, right? This is your document. You can share it with your family or people who support you. Tell them what's important to you. And then this is where you're really going to write down some instructions for how you want to be cared for. And if we do this, if you have a healthcare agent, they get a copy, right? And if not, we share it with the healthcare provider if you want. This is what it looks like. This is in the Getting Started Toolkit. Sorry, it's so tiny. But in Massachusetts, this is a personal document. It's not legal. And that means we don't have a law that stands behind this that makes doctors follow it. They're not obligated to follow it, but we do have a law that says if your doctors know what you want for care, they should do their best to give it to you. And that's why this personal directive is so helpful. So the first part of this, it's 2 pages. The first page is like a personal letter to others. You're basically writing in your name if you have an agent, and then in that number 1 section, giving people some idea about what's really important to you if you get sick. Do you have some personal values or religious or spiritual beliefs or family traditions you want people to know about when taking care of you? What worries you most? And that question in number 4 usually lets people know a lot about you and how you want to be cared for. There's some questions on if you get seriously ill and what you would want. You can write in the questions, you can write in the back, you can skip questions. This is your document. You can write whatever you want. Number two has been really helpful, especially if people don't have an agent, a healthcare agent. Who do you want to know that you're sick? And can they help with a job? We often see people saying, here, please tell my neighbor will come in and help my cat, feed my cat. It can be personal as well as healthcare here. On the next page is where we're going to write down more about your medical choices. And in A there, it really has been helpful for people to write in what they know about their current condition. We know best how things work for us. Do we have, excuse me, preferences on medications? Are there places we want to be treated, different hospitals we want to go to, places we don't want to go? You can write that in right there. And as people progress with illness, if you're not seriously ill, but you're dealing with a lot of complicated medical conditions sometimes, you know that you're doing pretty well today, but at some point you might have a medical emergency, and that emergency might be life-threatening. And if that's true, some people want to be able to write down their preferences for what they would want if their heartbeat and breathing stopped, what they want CPR, basically. And this is where you check a box about your preferences or not. Number two there is also about any other treatments that prolong your life, if you have personal preferences about that, or you can write in some instructions. Now, this is optional, right? But we have found, we were asked by a lot of our mid to older citizens to have this section in the personal directive, just in case that happens. They want people to know their choices for that. And so you can write anything else in here, any instructions, any personal messages for folks. As I said, right on the back, you can add your medication list if you want. You sign it and date it. It doesn't need witnesses. This is personal to you. The trick to this document is that you take it out every once in a while and make sure it's still what you want for care, that your choices haven't changed. And if they have changed, you write it in. So that's that personal directive. So we hope in the best worlds that you're able to choose a healthcare agent. That's great. We do that healthcare proxy. I recommend you think about that personal directive. What we have found, we had a family talk to us the other day about that personal directive by saying it was such a great family around the kitchen table discussion, because the question was simply came from the mom saying, I want to tell you some things. And she said to her family, if I get sick tomorrow, here's what I want for care. And then that was just easier for the whole family to go through that personal directive together and talk about it. So it can be used in many ways. So once we do these documents, one or both, it's important to get them in the hands of our care providers, right? It's great to keep copies, put them everywhere, but let's make sure we get them in the medical record. And this is that step 3, that important step about giving those documents to your doctors. It really starts a great conversation about how you're feeling today. What are your goals for care? What's most important to you? And also the question of what's ahead for me? Given my medical condition, what do you know about what I might be facing and the information I might need to make choices? So those are the conversations that these documents tend to start. But we want to definitely share those planning documents and put them in the medical record, right? So they're right there for everyone to see. And then the idea with this toolkit is just that it really does help people get better care right now, today, because you're starting conversations with your physicians and doctors about that. And you're also planning for care over your lifetime. The other thing that's in the Getting Started Toolkit is just a consumer guide. We have some discussion guides. Often people came to us and said, I've got 15 minutes to talk to my primary care person. What should I talk about in terms of my health and my plan? So over the years, people have helped us put together this 5 things to talk about with your care providers in terms of making a plan. There are those rights. Remember, we talked about early on those rights for information to make choices. So we have some sample questions that you can use. Some of these, you can use your own questions, but this is the first one is the one that seems to open the door to these questions is, I'd like to understand more about my health or my illness and what you're recommending for treatment options. Here's what I know. Here's what I want to know today. And you can be specific with that and to talk about, well, and can we talk about what's ahead for me? What information do I need for future planning? So those are sample questions. And then you see that it goes on to discuss your goals and care. Um, Telling your care providers about yourself and what's important to you is important. And how do you get that written down in a plan, which is that next step? And the whole point is that your providers are able to know your choices and to honor those choices. So take a look at the conversation guide. When you in the toolkit, you have these 5 questions, and then we have blank lines underneath. You could just bring it with you to your next visit, put down the questions that you want to ask. That's how it's been used, and we've heard a lot of great things about it. So that's in the toolkit. And I want to remind you that in this toolkit, really it belongs to you. No matter who gives you these documents, whether it's your doctor or your hospital, these are yours. They're your personal choices. You own them. Even though the hospital might have their name on it, it's still your document. Those are your choices. So you want to make sure you always have the original document, especially if you're doing it in a doctor's office or a hospital or a nursing facility. Sometimes they forget to give you back the original. Just you want to have that. Those are your choices. You get to make as many copies as you want. The copies are as good as the original. You can change it, right? Your health is going to change over your lifetime. Everybody does. And so as your health changes, your healthcare decisions might also change. So you want to update those documents, make sure everybody has them so you can share it with anyone you want. Make sure we give it to the healthcare agent, to your family, to your doctors, really anybody you choose. Just keep good track of them, who has the documents. So if you change them, that you can give people updated copies. So that's the Getting Started Toolkit. And if you've already done your healthcare proxy, terrific. I would just suggest that make sure it's still valid, make sure it has those 2 witnesses on it, and the phone numbers is what's tricky. People change phone numbers a lot. So it's good to check the document to make sure the phone numbers are up to date. See if it's in your medical record. Ask your doctor, can you see this in my medical record? And it may or may not be there, even if you've given it to them. So it's good to double check. Do a personal directive that's great for you, your family, your doctors, and just make sure things are where you want them in terms of having conversations about care. That's the Getting Started Toolkit. I also want to tell you about a new toolkit we have. We just introduced the other day. We work a lot with folks with a range of disabilities. So people who have a dementia, a beginning dementia, a middle dementia, or more serious dementia, and many other forms of abilities or disabilities. And we wanted to offer them a different toolkit. And does the same thing, right? We're capturing what it is people want for care. But this is where adults can choose a trusted, supportive person to help them make this plan. So that person might also be the healthcare agent, or it just might be anybody at all. Sometimes when people use this toolkit, they don't have the ability to do that healthcare proxy. So what they're doing instead is they're picking a supportive person, a family member, a care provider, and saying, you help me through this process. So that's what this toolkit is good for. You have your own fill-in personal care plan. And in this one, we designed it so people could write in things, or we could copy and paste in pictures. For people who may not have verbal skills, they can show us what they want for care. We can do it you can download this kit on the computer, or the supportive person can help make their own digital document and cut and paste in those pictures. There's more information on our website. And then the Next Steps toolkit is helping to build on your discussions over time. So many of you might be here. You may have already started and you want to think about what else do I need as I go forward. So first we have a consumer more conversation guides, because a lot of what we're doing when we're managing chronic illness and we're moving into serious illness is having conversations with our doctors about what it is we need and what our choices are. So you'll see that this is all on our website and in the in the next steps toolkit. You'll see guide 2, right? Which is how do I manage my health and chronic illness? Guide 3, living well with serious illness. And guide 4, for people with serious illness, there's a whole division of medicine called palliative care, which is extra support to help you feel better and live with serious illness. So all of that's there on the next steps toolkit. These are the rest of the documents that people are most curious about. So after we've thought about and hopefully done a healthcare proxy or a personal directive, which is in that getting started toolkit, in the next steps toolkit, we look at these documents. Now you can do them, you can do a durable power of attorney anytime you want, but it just happens to be here. I'm going to show you what that is, and then we talked about the other documents are the MOLS form and the comfort care do not resuscitate order. This is voluntary. You can add these to your plan or not as as we go. So this is the durable power of attorney. We don't have a document. What we have is a fact sheet, because we really encourage you to go do this with an attorney. And no matter how small your estate is or your money is or your bank account, it's what you have to pay for care, and you want to keep it safeguarded. So in a durable power of attorney, you would choose a person you trust. That person is called an attorney, in fact, but it's like an agent, as your financial decision maker. So in a healthcare proxy, you pick a trusted person to make healthcare decisions. In the durable power of attorney, you're picking the financial decision maker. That person, if you're not able or you need help in making financial decisions, sometimes we just need help. You can give that person some powers to protect your money, your property, your financial matters. Mostly how this works out is if that somebody has their healthcare changes, that durable power of attorney can help pay for care. They can have access to your money, your bank accounts, be able to sign contracts, be able to get home care folks to you. That's what a durable power of attorney does. One of the things this is coming up with lately is that if we do this early, it can avoid a conservatorship. It's a legal proceeding I'll tell you a little bit about, but we don't want to get in that position where if we lose the ability to make decisions about our finances, our bank accounts will shut down. No one will be able to get into them. And in certain circumstances. So the only way to do that is to go into a court process, into a conservatorship, and to appoint a person to help with that. We're going to try to avoid that process if we can. I'll show you what that process is. But again, if you're at a point where you're able to choose someone to be a financial decision maker, it can be anybody you want. It might be something to really explore. The last two documents are medical documents. Pretty much all people know what the DNR is, and we explain that. I just wanted to show you the MOLS form. This is only for people with a serious or advanced illness. That's it, not anyone else. The idea is I now have, say, for example, a life-limiting illness. I have an advanced cancer. And I know at some point I may need to make decisions about if my heartbeat and breathing stop, do I want them to try to revive me? Yes or no? If I'm not able to breathe on my own, do I want to be intubated or have other ways, other artificial breathing? If I'm very, very sick and at the end of life, do I want to be transferred back to a hospital, or do I just want to be made comfortable where I am? Those are the decisions in a MOLS form. And you can see we don't want to do this early. We want to do it at the point where we have a current life-limiting illness. And so you'd sit down with your doctor, talk about your prognosis and what you want for care. The patient chooses the A, B, and C, what they would prefer, but it's the clinician then. You're sitting with your doctor or your nurse practitioner or physician's assistant. They can all do this, and they check the boxes. And then it's their order. So they're going to sign this form and you're going to sign this form. Your healthcare agent can also sign the form. And then the whole idea of this form is this is your plan, right? If something happens and one of these choices have to be made, you've already told people what you want. This goes into your medical record. You keep a copy of it yourself, and it can be updated at any point in time. Remember, as long as you have the ability to change your mind and make decisions, you can. But this has been a very helpful planning tool for people with a very serious illness. You want to know more about that? You have to talk to your doctor about that, because they hold the forms. Okay, let me know if there are questions. We're giving you a lot of information about forms. We just have a few more slides here. We get a lot of questions about what a guardianship is, what a conservatorship is, and if there are alternatives to this. So we have a new webpage on our website, and you'll see it under in the resources section. Just go to guardianship, conservatorship, and it tells you what a guardianship is, what a conservatorship is, gives you a checklist for if you're at that point and you know somebody at that point, what are the things to consider and things about the process itself. But very briefly, I'll just tell you the difference because it very much depends on what state you live in, how this gets defined. In Massachusetts, we have broken this up into two separate legal proceedings. They're very protective for people, but they're also very restrictive of your rights. So we don't want to go here unless we need to. And we're going to consider any alternatives to this, and that's what's on the webpage. But a guardianship adult typically happens when someone has not been able to fill out a healthcare proxy, has not been able to say, here's who I want to make decisions for me, and done a healthcare proxy. And that's why that proxy is so important, because if you can fill out a healthcare proxy, you can definitely avoid guardianship. But if people get to that point where they're not able to make decisions and you need someone to really, help you with healthcare, the court can get involved in a legal proceeding, appoint a person to be a guardian. That guardian makes personal and healthcare decisions for you, for someone who lacks that ability to do it. And that's what guardianship is. Conservatorship is a whole nother process, right? This has to do with money and finances, this one. So conservatorship of an adult is a legal proceeding where the court can appoint someone called a conservator. The conservator's job is to help make financial decisions, manage the money, make sure you're getting care that you need to. And it's for a person with a disability or an incapacity. So one of the ways to avoid conservatorship is if you do that durable power of attorney, right? You've appointed someone already to make these decisions, and you can avoid this. So if you know people at this stage, this is a really big and complex process. Just go to our website and take a look there, and there's a lot more information for you. All right, and that pretty much brings us to the end of this. We'll just sum up by saying that everybody here can start with a simple conversation, right? Use our Getting Started toolkit, that 1, 2, 3 process. I believe it's in your email, or we can always resend it again. Excuse me. One of the things to look at on our website is even to make this easier for you. If you go to the Honoring Choices website, and it's just honoringchoicesmass.com, we'll show it to you at the very end, there's a little green button at the top called Quick Start. And you can just press that button to see we hope for everybody in the state who's 18 and above, it's a quick way to choose an agent and complete a healthcare proxy, just the document itself. Right? You don't have to do the whole toolkit, you could just do the document. And what you'll see on that quick start page is how to choose an agent. We have a video for how to do that. It gives you a lot more information. How to complete that healthcare proxy. They're there in 16 languages. The wallet card is also there to download. And then that instruction about making sure you share the healthcare proxy. Give a copy to your agent and your doctors as well. And this is where you'll see information also that if you're not able to choose an agent, that's okay. Just start with that personal directive. So this is a really quick way to do it. just to do if you just want to do a healthcare proxy, I'd start here, or you can use the Getting Started toolkit. And that's really it. Everything we talked about today, I know there's a lot of information, but it's right on our website. You'll see the quick start pages there, and then the very last tab on the website on the top on that navigation bar says resources. And all of the documents are right there for you. And there's the link to those resources at the bottom. We thank you so much for listening. I'm happy to answer questions. I'll stay right here. And if we need to, we can put the link to the Getting Started Toolkit right in here if people are not getting that. But there's our website, honoringchoicesmass.com.
Hello, everyone, and thank you so much for showing up, not just for today's program, but for your role in building our communities where we all want to thrive. If you would like to learn more about AARP, our advocacy, our volunteer opportunities, please visit aarp.org/MA or AARP/local. All of the materials that you've seen today in this presentation will be sent to you within 48 hours. Ellen, thank you again so much for your time. And again, if anyone has any questions, you all can just reach out to AARP through our 800 number or through our website. Thank you so much and have a great day.
Thanks.